Hi, I'm Julian Crossley. I'm an osteopath and I work in the northeast of England, in Stockton, which is between Darlington and Middlesbrough. And I've been an osteopath for about 17, 18 years. I came across K-Laser at an osteopathic convention and started talking to Stephen, who persuaded me to have a little go with the K-Laser on some of my chronic patients. So that's probably about 7 years ago. I borrowed the laser for 4 or 5 weeks and noticed how a lot of my chronic patients seem to have a longer period of time without pain while treating them. So my chronic patients quite often would have long-term issues with spines or arthritis or repeated inflammation on old injuries. And it is actually often quite difficult to help patients understand how to manage those conditions because they're from various different age groups, but they'll often find it difficult to spend the time to manage those issues themselves. So along comes the osteopath and would from time to time treat to manage those conditions every 4 or 5 weeks. And I noticed when using the laser that, first of all, straight after the treatment on a chronic condition, the patients would notice a greater freedom of movement. So these are the descriptions they've given me. Less pain. They would find it a lot easier to do their repetitive tasks, maybe. And having treated a jolly good handful of people over the 4 or 5 weeks, I decided, rather nervously, to buy a K-Laser. And in the back of my mind, actually, I did it because at 50, I would love to be able to be treating patients 10 years on from now. So saving the hard work of my hands and improving my patient outcomes.
And treat yourself.
Was a no-brainer. Yes, indeed. And indeed treating myself. I currently have no back pain. And part of that is because I use K-Laser. But for sure, it helps my clinical practice. And rolling on 5 or 6 years on from then, I've actually bought a second laser with a little help from some local business system that helps small businesses. And I have a practice associate who's a sports therapist who uses that on her sports injuries. So we've got kind of a two-pronged approach, if you like. I try to generally treat chronic conditions, and I'll use the laser as an adjunct to my treatment. And I find that my sports therapist will often use it for the acute side of things as well, which she finds really useful. So,
brilliant!
Hands up, K-Laser.
How often do you use it per day?
Well, I think probably it takes about 50% of my treatment time. So if I'm using the K-Laser, I will always use it with an adjunct, using osteopathic manipulation. Sure. I'll always back that up with a K-Laser session in the same half hour. So it sort of helps to just improve what I was doing before, and also probably I see people a little bit less now, which you might think is a bad business protocol, but it's not, because people then start to talk about the fact that I'm using K-Laser and come and see Julian, it's this new amazing tool. And within those groups of people, when I have from time to time seen new patients with, shall we say, strange long-term conditions, and after 2 or 3 sessions they are like, they run around gospeling our name. I mean, it's not us, it's the laser, obviously, but gospeling our name that we've been able to solve their long-term issues of sitting or their long-term issues of back pain or whatever it might be. So yeah, it's a really useful tool.
Fabulous. And would you say that that's generated new profit for you as it opened new treatment opportunities?
Well, I've been doing this for about 13 years in one place. And I think what it's done is it's made my practice consistently full. Okay. It's always a bit hard to know. I mean, definitely people will pick it off my list of treatments. They'll often book in for a laser session. But what I haven't done is charged more for a laser session.
Okay.
I have just made it, because my business brain is simply that I'm thinking about longevity. I'm trying to give my patients ultimately the best treatment or groups of treatments that I think are necessary to help them. So I've not gone down the route of saying, yes, and you can buy a session of K-laser for £40-50 on its own, although that may well come because, as you know, Antonella, we've just had a conversation about potentially promoting what I would describe as those quirky things that aren't necessarily osteopathic, that the K-laser, because I've got the tool, so that the K-laser can treat. So, are they under a broadly inflammatory umbrella?
Yes.
Yeah, so my desire would be to help myself, really, get that second laser working a bit more, to promote almost like a second part to what our clinic's doing. Yes. So,
absolutely. And in terms of training and clinical assistance, are you happy with the support that you got from K-laser as a brand?
Yes. What's great, I almost feel like I want to pick up this K-laser. But
You can if you want.
What is great about the K-laser is if you compare it to other lasers on the market, some of which, to be honest, are a little bit cheaper, it's such an easy tool to use. Whilst safety is really important and protecting your eyes and protecting the patient, and although it's a class 4 laser, it is still a cold laser, and it's very easy to use. I mean, honestly, a child could use it if that was legal.
If properly trained, yes.
Yeah, exactly. So once the training is complete and people understand what they're doing, it's pretty difficult to get your treatment wrong. And I know for a fact that I have used the wrong protocols before, but I still had quite good outcomes and then realised I got the diagnosis wrong. So, yeah.
Fabulous. So in general,